Avoid unnecessary surgery. This Good Morning Washington Spotlight on Your Health is sponsored by Regenerative Orthopedics and Sports Medicine.
Well, today's Good Morning Washington Health Spotlight focuses on tackling an important topic, treatment for PTSD. I'm joined now by Dr. Sean Mulvaney with Regenerative Orthopedics and Sports Medicine. First of all, thanks for joining us.
Man, thanks for having me, Brian.
So let's talk about it. You're involved with some groundbreaking treatment for PTSD. Let's touch on that.
This has been going on since 2009. There's over 30 papers in the peer-reviewed medical literature. So this is new to many people, but it's not a new concept.
All right.
And then what we do is we actually are resetting the fight or flight nervous system. So what happens is the brain starts having the body amps the brain. Usually that just spins right down. In PTSD, it gets stuck in the on position. There's a lot of ways you can go about this, but what we do is we just go in and through a straightforward but precise injection in the neck of local anesthetic, we actually turn off that fight or flight nervous system temporarily and reset it. And when we do, we see durable results where people have pretty dramatic improvement.
Wow. Well, let's talk about your unique background and how you use it to help treat patients.
My background is I was a U.S. Navy SEAL for 9 years, and then I was a physician within special operations for the next 22 years. So I retired after 31 years total service. And what I saw during that time is people were coming to me asking for help with PTSD. And a lot of times they had already tried behavioral health, which I don't want this to be in any way like I'm squaring off against behavioral health. It is an essential part of what we do, and we always refer people to that. But sometimes they get stuck. Sometimes they can't move forward in their therapy, or they're on multiple medications, unable to move forward, and they're still even, frankly, suicidal. This is where you don't have to wait till somebody gets suicidal, but we can jump in, reset that system, and the results are immediate.
Wow, it's amazing. Let's talk about your philosophy toward healing.
My philosophy toward healing is, this is going to sound strange for a medical doctor, but all medicines are poisons. They poison the system, and you hope that the benefits you get exceed the adverse effects that they cause. So isn't it better to actually fix something when you can? When you can fix something, wouldn't you rather have it fixed? And I think most people, it's intuitive.
Would lean that way, as long as they know there's an option, an alternate, right? A different option.
Sure.
So for people at home that are struggling with PTSD or have a loved one that's struggling with PTSD, what is the first step for getting help?
They should start with the standard treatments. They should see their behavioral health specialist. They should see even their primary care physician to get started. But if they're stuck and things aren't moving forward and things are getting extreme, things are getting bad, some people won't let anybody know what's going on until it spirals out of control, possibly even suicidal. Unfortunately, it's not uncommon. Then what they do is, if they've tried those other things and they're not working, call our clinic, call Rosum, we'll get you set up.
Okay.
And it's a less than 1 out of 10 for pain. I know it sounds weird. The notion of it to somebody who's not initiated to this sounds very strange. That's why we have these 30 paper in the peer-reviewed medical literature. We have high-level studies supporting this, but still a lot of people, the word is being slow to get out, but still it is getting out there.
All right, so very important information right here. There's alternatives, and if you can make a difference and help someone with PTSD, no matter which avenue, it sounds like you're giving options and you're giving hope.
It is dramatic, because when people feel better, they feel better right away, usually within minutes to days.
Wow.
And so we're actually just resetting the system, and in many cases it makes a huge impact in not just their life, but the life of their families.
All right, well, Dr. Mulvaney, thank you so much for your time today.
I really appreciate it, Brian.